My name is Muriel Mora. I am a medical student. I want to talk about Dapagliflozin and cardiovascular outcome in type 2 diabetes. Definition. Type 2 diabetes, the third diabetes mellitus decrease the size of abnormal carbohydrate metabolism that are carried by hyperglycemia. It is associated with a relative or absolute impairment in insulin secretion, along with varying degree of peripheral resistance to the action of insulin. Dapagliflozin. Sodium glucose transporter 2 SGLT2 inhibitors are a relatively new class of anti-hyperglycemic agents for the treatment of type 2 diabetes.
Hi, this is Tom from ZeroToFinals.com. In this video, I'm going to be explaining how SGLT2 inhibitors work. Now, SGLT2 inhibitors are used in type 2 diabetes to help to reduce the blood sugar levels. They differ slightly from most anti-diabetic drugs, which work by either increasing the insulin in the body or increasing the insulin sensitivity of the cells of the body. And the objective of increasing the insulin or the insulin sensitivity is to get the body to take more glucose out of the blood and to store it in the tissues. And that's how they reduce blood sugar levels. However, in SGLT2 inhibitors, they work slightly differently. They work by causing the kidneys to excrete glucose into the urine. And by excreting glucose into the urine, you reduce the amount of glucose or sugar that's in the blood and the rest of the body. For this video, I'll give you 3 examples. The first is Dapagliflozin, the second is canagliflozin, and the third is empagliflozin. And if you remember these 3, you're unlikely to come across very many others. But the clue is that all of them end with gliflozin. There's only one real indication for these medications, and that's type 2 diabetes. Let's go through the mechanism of action. Firstly, in order to understand how SGLT2 inhibitors work, we need a very basic understanding of the function of the kidneys. So let's go through that briefly. So to briefly go through those, the kidney is made up of about 1 million tiny tubes called nephrons.
Application in medicine. Dapagliflozin 10 mg daily provides glycemic control and reduce body weight and systemic blood pressure when added to usual background therapy impacted with inadequately controlled to the pre-existing LCVD and hypertension.
Over the past 2 decades, several studies have highlighted the importance of intensive glucose-lowering therapy, blood pressure control, and statin use to reduce the risk of cardiovascular complications and mortality in patients with diabetes. But the long-term trends of mortality and cardiovascular outcomes of patients with type 1 or type 2 diabetes, as compared with the general population, are unknown. In a study of patients enrolled between 1998 and 2012 in the Swedish National Diabetes Register, a total of 36,869 patients with type 1 and 457,473 patients with type 2 diabetes were included, along with matched controls from the general population. The outcomes that were assessed were all-cause mortality, fatal coronary heart disease, fatal cardiovascular disease, and hospitalization for cardiovascular disease. The rate of all-cause mortality declined among those with type 1 diabetes by 29%, and in matched controls by 23%, a difference that was not statistically significant. The rate of hospitalization for cardiovascular disease decreased by 36% among those with type 1 diabetes, and by 9% among matched controls, a decrease that was significantly greater for the diabetic group. The rate of all-cause mortality decreased by 21% among those with type 2 diabetes and by 31% among matched controls, a statistically significant difference that favored the control group. the rate of hospitalization for cardiovascular disease decreased by 44% among those with type 2 diabetes and by 29% among matched controls, a statistically significant difference that favored those with type 2 diabetes. The authors conclude that mortality and cardiovascular disease have declined for patients with diabetes. For most cardiovascular outcomes studied, event rates have decreased at least as quickly for patients with diabetes as for matched controls. However, as compared with matched controls, patients with type 2 diabetes had a smaller reduction in fatal cardiovascular outcomes. Full study results are available at nejm.org.
Pros and cons.
All right, so let me move on now to treatment options for type 2 diabetes. We have newer anti-diabetic medicines. I'm not going to cover them all, but let's first look at trials related to SGLT2 inhibitors. Maybe, Chris, if you can just kind of tell us what that class is and talk about some of the outcomes trials. You don't have to go into all the details, but give us a broad view.
Well, this has been such an exciting time, and the first of these trials was the EMPA-REG trial with Dapagliflozin, an SGLT2 inhibitor. It inhibits the exchanger so that glucose goes out in the urine, but changes probably pressure in the glomeruli in the kidney. You get weight loss and lots of other beneficial factors with the entire class. And so out of surprise, there was a significant reduction in
Pros. The study suggests that using both dapagliflozin and insulin have an advantage. The doctor measured values to see how well blood sugar levels are regulated or the longer term. These measurements show the average blood sugar levels over the last 5 months. Cons. The study showed that dapagliflozin have a disadvantage in terms of these side effects. Urinary infection occurred in 16 of 100 patients who received both dapagliflozin and insulin compared to only 4 of 100 patients who received insulin alone. Used application in Ecuador. Resisted the inhibitor of sodium glucose cotransport type 2, CETL2, used for the treatment of diabetes mellitus type 2 have demonstration a cardiorenal protector effects. Experimental acid and different studies have established that the inhibitor of CELT2 reduces the progression of hypertrophic cardiomyopathy, fibrosis cardiac, remodeling, systole, diffusation, and heart failure.
So my overall impression was that this trial, like other SGLT2 inhibitor trials, again proved that there is substantial benefit in terms of reduction of heart failure hospitalization risk. As you know, there was a split primary endpoint of this trial. The MACE endpoint did not reach statistical significance, but the combined endpoint of cardiovascular death and heart failure hospitalization did reach the endpoint, which was positive.
Conclusion. The results obtained from the use of dapagliflozin have been favorable. Concluded that its use considerably reduces the risk of CVD and improves the quality of life of patients with due to its hypoglycemic properties.
Now we'll move on to side effects, and these mostly tie in with the precautions that we just discussed. So urinary tract infection is one of the most common side effects you can experience because of the reasons we talked about. And this is much more pronounced in women. Women are at a higher risk for UTIs compared to men in general. So this can happen in up to 6% of patients. And I would guess that this percentage would be much higher if we were talking just about females. Also, those that are 75 years old and older are at an increased risk of getting this side effect as well. Genital infections are also possible, and this is primarily in women. Nasopharyngitis is also listed as a possible side effect, with around 7% of people getting this. And this is basically having symptoms that mirror a common cold, stuffy nose, and inflammation of the nasal cavities. And when I see this listed as a side effect for a medication, it makes me wonder if the drug is really causing this. So in the clinical trials, if you get nasopharyngitis, it is reported as a side effect. Now the question I have is it really the drug causing this, or are these people just getting a common cold? I'm not really sure, to be honest, but it is listed as a side effect for Farxiga. You can also see an increase in urine output and nausea in a small percentage of people. Now, one nice thing about Farxiga is that hypoglycemia is not very common when it is used alone. If you are taking other diabetic medications,